Hello everyone. In today's video, we are going to discuss an interesting case of painful ring finger apparently fitting into the diagnosis of trigger finger and how musculoskeletal ultrasound unraveled another unexpected pathology in the same patient that significantly altered the treatment plan. Was an elderly female presented with complaints of restricted flexion of left ring finger since 1.5 months. She also complained of this palpable, slightly painful nodule over the palmar aspect of left hand, which was in line with the ring finger. So clinically, the diagnosis of left ring trigger finger was done, and this patient was referred for ultrasound for preoperative confirmation of the clinical findings. So let's see what ultrasound revealed. Consistent with the clinical diagnosis, there was significant thickening of the A1 pulley of left ring finger. These are the flexor tendons, FDS, flexor digitorum profundus, and that's the significantly thickened A1 pulley. On dynamic evaluation, this is the thickened A1 pulley and there is restricted movement of flexor tendons underneath the thickened A1 pulley. So ultrasound diagnosis was perfectly fitting into the clinical diagnosis. However, what I noticed was this thickened A1 pulley was located slightly distal to the palpable soft tissue nodule complained by the patient. So I again scanned the patient. If we carefully look at this video, these are the flexor tendons of ring finger and there is some hypoechoic soft tissue thickening that is located just superficial to the flexor tendons, that is at the level of palmar fascia. So this is elongated soft tissue thickening, hypoechoic thickening in the subcutaneous superficial plane. This is at the level of palmar fascia. It is just reaching the flexor tendon sheath but not completely encroaching over the tendons. So this is the FDS tendon, this is the FDP tendon, and that is the flexor tendon sheath, and overlying there is this hypoechoic soft tissue thickening. Longitudinal image, this is the FDP tendon, that is the FDS tendon, that is the flexor tendon sheath, and this is the hypoechoic thickening involving the palmar fascia. So what is the diagnosis? Yes, it is consistent with Dupuytren's disease. So this is the thickened A1 pulley and this is the Dupuytren's contracture or thickening of palmar fascia that is just reaching the flexor tendons, and it is located approximately centimeter proximal to the thickened A1 pulley. So ultrasound made the diagnosis of these two conditions. Trigger finger is fibrocartilaginous metaplasia of A1 pulley. Along with there is inflammation and degenerative change in the flexor tendon sheath. Whereas in Dupuytren's disease, there is chronic fibroproliferative disorder of palmar fascia in which there is abnormal production of collagen, particularly the type 3 collagen. This leads to formation of nodules and cords in the palm and fingers. These cords progressively shorten and cause drawing of fingers into flexion contractures that significantly limit the hand function. So, with the help of high resolution ultrasound, we diagnosed two pathologies affecting the single finger. But is it going to affect the treatment? Definitely. Trigger finger treatment involves mainly corticosteroid injections, splinting, and if not responding, then surgical release of A1 pulley. Whereas in Dupuytren's contracture, treatment involves collagenase injections, needle aponeurotomy, fasciectomy, and even there is role of radiotherapy described in literature to prevent the disease progression. So diagnosing the coexistence of these two pathologies, trigger finger and Dupuytren's disease in the same patient is of paramount importance for planning the correct treatment. This video highlights how exquisitely musculoskeletal ultrasound can diagnose various soft tissue finger pathologies and helps in deciding the treatment algorithm.